I'm Nurse Jackie. I'm going to be doing a head-to-toe assessment on you. Do I have your verbal consent to film this?
Yes.
Okay. Before I start her assessment, I have already completed her general survey. I have assessed her appearance versus age, nutritional status, her grooming, also her vital signs, her pain levels, her posture, her positioning, and also assessed her demeanor, her mental status, and observed that she has normal facial expressions, eye contact, composure, and affect and speech. All right, before I start this assessment, I'm going to wash my hands, okay? I'll wash. All right, after I wash my hands, I'm going to assess for orientation. All right, can you tell me where you are?
At the University of Virginia Hospital.
All right, and what's today's date?
November 21st, 2015.
All right, great. First, I'm going to be inspecting your skin. I'm just going to be observing for any lesions, looking at your hands and your nails. I'm just checking your legs too for any lesions. All right, and I'm also palpitating for temperature, moisture. And I'm just going to take a pinch here, checking your tuger. And just to let you know, I'm going to be assessing your skin throughout the full head and toe assessment, okay? All right, next I'm going to be inspecting her head. I see that it's symmetrical and it's proportionate to her body. I'm also going to look at her head and see if the hair distribution is even, her hair condition, the scalp condition, see if there's any laceration. Then I'm going to palpitate. Is there any tenderness?
No.
All right. Also looking for any infestation, feeling the texture of her hair, and looking at her scalp condition and any scaliness. All right. Next, I'm going to be looking and inspecting her eyes. I am looking at her eyebrows, her eyelashes, checking her conjunctiva, cornea, sclera, lacrimal sac, and lacrimal glands. I'm going to palpitate your lacrimal sac and your glands, checking for drainage. All right. And next, we're going to have you follow my finger with just your eyes. And this is going to be testing your extraocular muscles, cranial nerves 3, 4, and 6. All right. Just look in the center. All right, great. And next, I'm going to be looking at your pupils, okay? I'm going to take my pen light out. I'm going to shine a light in your eye and look for direct and consensual pupillary reflex. Have you stare at me, and I'm going to shine this light. And I'm noticing that her pupils are equal, round, and reactive to light. Next, I'm going to be testing her accommodation. I'm going to have you look at an object in the distance and then look at my fingers, okay? All right, look at an object in the distance and look at my fingers. And I'm testing for accommodation. Next, I'm going to be assessing her or inspecting her ears. I'm seeing that they are symmetrical and in general position on the head. I am looking at her auricle, tragus, and lobes, seeing if there's any drainage and lacerations. I'm going to also palpitate any tenderness. Okay. Palpitate her tragus. All right. And next I'm going to be doing the whisper test. I'm going to whisper a word and you're going to repeat it if you hear it. All right. I'm going to cover her ear.
Star. Moon.
All right, next I'm going to be inspecting her nose. Just going to see that it's symmetrical and aligned with her face. Going to assess the skeletal structure and palpitate for tenderness. Is it tender? Okay. All right, and I am going to have you close one nostril and breathe in. And then next nostril and breathe in. All right, and I'm testing the patency of her nostrils. Also going to palpitate your frontal sinus. Any tenderness?
No.
Maxillary? Any tenderness?
No.
Okay. All right, next I'm going to be inspecting her mouth. I'm going to put gloves on. Before I do so, I'm going to look at her mouth and inspect the her lips if they are dry, moist. Then I am going to take my pen light and look into her mouth. I'm going to have you open your mouth for me. Check in her gums, dentation, and buccal mucosa, and her posterior pharynx, and her uvula to see that it is midline and no lacerations. Next, I'm going to be looking at your tongue. I'm going to use some gauze to inspect her tongue. All right, stick your tongue out for me. All right, I'm just going to look around the tongue, see the texture of the tongue, the color, see if there's any lacerations. And next, I am going to test the muscle strength of her tongue. All right, so I'm going to have you put your tongue against a cheek, and I'm going to feel for it. And her muscle strength for her tongue is a 5 out of 5 against resistance. All right. And next, I am going to, again, look in your mouth and have you say, ah. I'm checking that her uvula is midline, and it does rise when she says, ah, and that's testing cranial nerves 9 and 10. All right, next, I'm going to be inspecting her face, seeing everything is in the general position, her ears, her eyes, everything's symmetrical. There's no lesions. I'm going to test her muscles in her face. I'm going to have you make an expression. All right, puff your cheeks. All right, and raise your eyebrows. Okay, and her muscles are great. She has movement in her face. All right, next I'm going to be inspecting her neck and seeing that her trachea is midline. Then I'm going to palpitate her thyroid. See that? I feel it there. And then we're going to do the swallow test. I'm going to have you swallow water and making sure that her larynx moves up and down smoothly. Okay? All right, and it does move up and down smoothly for the swallow test. All right, next I am going to test the strength of the trapezius and sternocleidomastoid. I'm going to have you shrug your shoulders and don't let me push down. All right, strength is 5 out of 5. Going to push against your face. Strength is 5 out of 5, and clench your jaw and don't let me open your mouth. Strength is 5 out of 5. All right, and next I am going to be doing the Dole and Sharp test. And let me know, this is dull and this is sharp. And let me know if you feel dull or sharp with your eyes closed. Testing her sensories.
Dull, sharp, dull, sharp, dull, sharp.
Okay. And also I am going to take this tissue here, something soft, and tell me when you feel a light feel. Okay?
No, 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 no.
All right, very good. All right, next we're going to be inspecting your lymphatic system. I'm going to palpate her lymph nodes. I'm going to start with the preauricle lymph nodes, palpitating, and her post-auricle, tonsillar, her clavicular, anterior clavicular lymph nodes, submandible, submantle, supraclavicular, inferior clavicular, and also her axillary. Once I get down to the legs, I will also assess her inguinal lymph nodes. I'm going to have you relax your arm. All right, I'm going to go deep central, feeling your lymph nodes here, posterior, anterior, and lateral. I'm going to do the other side. Feeling for deep central, anterior, posterior, and lateral lymph nodes. All right, next, I'm going to be inspecting her posterior chest. I'm going to have you turn around for me for the camera. and keep you covered. Looking and inspecting her skin. Do you mind if I lift up your shirt? Bring that up. I'm inspecting her skin, looking for any lacerations. I'm also looking at the rhythm, her respiratory rhythm patterns, looking at the contour, looking at the anterior and posterior diameter of her chest. All right, next I'm going to palpitate for any tenderness. So let me know if you feel any tenderness. Anything?
No.
All right. Then I'm going to assess her thoracic expansion. I'm going to have you breathe in and out, and breathe in and out. And that was testing her thoracic expansion. All right, next I am going to percuss her posterior chest, starting at the higher part of the clavicle. And in the center, not on the scapula. And her lateral. I'm going to percuss the lateral part of her lungs. All right. Before I osculate her lung sounds, I'm also going to see if there's any tenderness. I meant to do that when I was feeling for any tenderness. I am going to see if there's any tenderness at the CVA area. When you feel a pound, let me know if there's any tenderness, okay?
Okay.
The coastal vertebral angle is what I'm testing. Any tenderness?
No.
Okay. All right. I'm going to have you take deep breaths, and I'm going to listen to your lung sounds. And then your lateral lung sounds. All right, next I'm going to be inspecting her anterior chest. If you could face the camera again for us. Keeping it covered here. I'm going to be inspecting her skin once again and her respiratory pattern and rhythm, seeing if any accessory muscles are being used, just like for the posterior chest, and any retractions. All right. So next, I am going to palpitate. Let me know if you feel any tenderness. Anything? All right. And then I'm going to also test her thoracic chest expansion. I'm going to have you breathe in. Now, breathe in. And out. Fingers go apart, then back in, so the expansion is good. And I'm now going to percuss, okay? Starting up here above the clavicle area, percussing her anterior chest. And then the sides. All right. Now I'm going to listen to your breath sounds. You can take deep breaths. Let me know if you feel dizzy. All right. Next, I'm going to be assessing her heart. I'm going to see if I see any pulsations, heaves, or lifts, and I'm going to feel for any thrills, heaves or lifts. And I'm going to palpitate the apical impulse right under. All right, next, I'm going to listen to your heart sounds, okay? I'm going to start in the center intercostal space, listening to your aortic region. Pulmonic. Tricuspid. And apical. All right, since I don't have a bell, adjust the diaphragm, I'm going to just do it one more time. But if I did have a bell, I would go back to those regions and listen again. Aortic, pulmonic, tricuspid, and mitral. All right. Next, I'm going to move to the peripheral vestibular system. I'm going to be inspecting and palpating her pulses. Everything is going to be bilateral except her carotid. All right, I'm checking her carotid, then her brachial, and then her radial, and then also I can also feel for your femoral. All right, and for the video, I'm going to just bring this down a little bit. I'm checking her dorsalis pedis and posterior tibial. All right. All right, next, we are going to be doing the thoracic assessment. Not the thoracic, the abdominal assessment. I'm going to have you lay down for me, please. All right. If you can lift up your shirt, I'm just going to inspect to see if there's any deformities. See that her umbilical, her belly button is midline, it's symmetrical. All right. And then I am going to listen to her bowel sounds. I'm going to start in the lower right region. And they're active. All right. And then I am going to percuss her abdominal region. You feel any tenderness as I do this? Okay. All right. She didn't feel any tenderness, so I'm going to do a soft palpitation and a deep palpitation, a light and then a deep, okay? Feel any tenderness as I do this? This is the light palpitation. Then I'm going to do deep. Any tenderness? All right. Next, we're going to be doing her musculoskeletal assessment. I'm going to have you sit up for me. All right. I am going to be checking to see that her extremities are within normal muscle tone. And there's no nodules and or deformities. And there's symmetrical. All right, next I'm going to be palpitating her joints, starting with her neck for any sensitivity, tenderness, warmth, crepitus. You can feel any? Down to her shoulders. Also with her shoulders, I'm checking her scapula. Her elbows. Any tenderness? Her wrist. And of course, all the joints in her fingers. Checking again. Any tenderness? Warmth, crepitus. All right. I'll check her hips once she stands up. I'm going to be checking her knees. Any tenderness? All right. And her ankles. And her toes. The one system I did miss was the peripheral vascular system. That was right after I checked the heart. And I should have looked for edema. So I'm going to also look for edema in her legs. And also clubbing in her fingers. All right. So back to the musculoskeletal assessment. All right. I'm going to have you stand up for me. All right. And we're going to test out her range of motion and strengthen her shoulders. I'm going to have you flex up and then down, extension, all right, and down, and then have your arms like this. Going to external rotation. Yep, very good. Down. And internal rotation, going to have you touch your back like this and show the camera. And then the other side. All right. Then I'm going to test the strength of her shoulders. I'm going to have you pretend you're emptying cans. All right, like that. Don't let me push down. This is her strength test. It's 5 out of 5. And have your palms up. And then try to turn them in. Strength is 5 out of 5. All right, next is going to be your elbows. I'm going to have you extend. All right, flex. All right, push against my hand. Strength and towards you. And strength is 5 out of 5. All right, next I'm going to be doing your hips. Going to inspect them. I didn't inspect them for tenderness. Is that tender? All right, we're going to do a range of motion there. I'm going to have you flex up and down and then up and then down and then out. You're going to abduct and adduct and abduct, adduct. All right, very good. And then I am going to have you bring your feet down. Bring your feet. All right. Bring them in. I'm just checking for external rotation and then out. This other foot, this leg. For internal rotation and then the same. In, external, internal. All right. And the last one we're going to do is your knees. I'm going to have you flex and extend, flex and extend. And I'm going to have you sit. I'm going to test the strength in her legs. I'm going to have you push and then pull back. All right. Strength is 5 out of 5 in her knees. And then next, I am going to look at her spine. Have you stand up for me, please? Just seeing that the spinal process is symmetrical. Any tenderness? Okay. Going to have you flex forward as you're touching your toes. Checking her spine. All right. And kind of lean back. Make sure she doesn't fall. All right. And that's extension. All right. I'm going to have you rotate your hips back and forth. Internal and external rotation. And bend side to side. Very good. All right, and that's assessing her spine. Now we're going to do a neuro test. I'm going to have you walk to the orange and back. I'm just observing her gait, seeing if there's any foot drop, anything abnormal, and her gait was fine. We're going to do a Romberg test. Actually, a pronator drifter test. Going to have you have your palms up, close your eyes. Going to be looking for any drifting. All right, and the Romberg test. Going to have you stand with your feet width apart. Close your eyes. Make sure she doesn't fall back. All right, this is checking balance. All right, and then I'm going to be assessing, last but not least, if you have a seat for me, your deep tendon reflexes. I'm going to start with your biceps. All right. And then her knees. All right. All right, and that pertains to our assessment. That was cutting it.